everyone, it's Jason from BodyWorx Physio. Here today to do a quick video on TMJ and jaw problems. So the TMJ, temporomandibular joint, is basically your lower jaw joins onto the rest of your skull. Now, we often get problems with this when we can get either degeneration in the joint, so similar to any other joint, it can get arthritis and wear down a little bit. The other thing that can happen is we actually have a little cartilage disc in there that can also get torn, similar to what happens in your knee with your meniscuses. So it's really it can either present as like just a pain in the jaw with increased aching and tension, or it can even present as clicking or locking. For example, when I was going through uni, I had a bit of problems with my jaw and I used to wake up in the middle of the night with my jaw locked out to the side. Wasn't the most scientific way of putting it back in because I was a uni student at the time, but I did used to hit it across. I wouldn't recommend that because you can do worse damage. It wasn't my first or second year, so I probably should have looked into that a bit more at the time. So it can click, lock, pain, give and get stuck in various positions. So it can also be related very closely to your upper neck. So your C1-2, the top one and two vertebrae in the top of your neck, can also have an impact on pain around into the jaw. So whenever we assess jaws, we also have a look at that upper neck region to see if there's anything going on in there and have a feel in there, because sometimes we can loosen that up and it takes away some of that jaw pain. On the reverse of that though, problems with the jaw can also cause tightening in the neck, which can generate headaches. So you can either get headaches from the jaw muscles in through here, running up here being tight and causing headaches, or because the jaw is having issues and you're clenching, you can tighten up the top part of your neck, and that can also send headaches around, which we call cervicogenic headaches. So the main causes of jaw problems are degeneration, stress and tension. So a lot of people, when they have experienced stress and tension, will clench their jaws, so they tighten their teeth overnight. So a lot of the time you don't notice it because it's not always a conscious thing. It's usually happening when you're sleeping at night. So that can be an issue because you don't always realize it until you're waking up each morning with tightness in the jaws and headaches. Other things that can cause affected are poor mechanics originally in your bite and in the way that your jaw has formed in your teeth, as well as trauma. So, copping a knock to the face in footy or in car accidents are common ways we see that. So what are some of the treatment options for it? Now, surprisingly, even though it sounds really horrible, dry needling into the muscles when they're tight can work really well to help loosen that off, as well as we're doing massage in through here, both externally and in some cases, even though it's kind of gross, putting gloves on and getting inside the mouth in along the gum and massaging and gently mobilizing the jaw joint to try and free it up a little bit. We then also usually give you a few little exercises to do to work on your range of motion. So stretching the joint just as we would with any other joint. So whether that be just gently going side to side and stretching it over, gently pushing down against the jaw, and then gently doing some gripping exercises with your teeth and relaxing afterwards. It is a bit hard to put ice packs and heat packs just because it's on your face sort of thing. The other things we usually recommend people follow up with is have a chat with a good dentist, because they can often do some x-rays, check to make sure that everything's in the right place, but then also advise on having a plate created for you that helps you helps you clench less. Sorry, total mind blank there. So helps you clench less. Other options, if you do think it is related to stress, having a look at talking to someone, whether that's a psychologist or your GP, about why you're feeling stressed, why you're feeling anxious, and dealing with that background issue. And then going from there, you can sometimes have a chat with somebody called a maxillofacial specialist, who really are the experts in those severe jaw issues, because sometimes it can come down to surgery, but we obviously always try and avoid that where possible. If you've had some jaw issues and you want to get it checked out, feel free to come in and have a chat with one of our physios. We do a free initial assessment for new patients, so if you haven't been to see us before, you can come in and have a quick 10 to 15 minute consult with one of our physios. There's no cost, no rebates for that, but please do let us know if you want that one when you're calling up to book. Otherwise, when you book in online, there is the option to select that at most of our clinics. So I hope that's given you some information. If you have any more questions, please give us a call on 4952-7033 or dive onto the website bodyworxphysio.com.au and check out some more of that information on there. Thanks and have a great day.